Welcome to Dialysis Unfiltered, real talk about life on dialysis, transplant, and everything in between. Each week, we share honest stories, hard truths, and helpful tips from lived experiences. Just a heads up, we're not medical professionals. Everything shared here comes from our own journeys. This means to make sure to always check with your care team or doctors for actual medical advice or treatments. So, let's grab your seats, start your sessions, and let's plug in. Hey, what's up, everybody? Welcome back to Dialysis Unfiltered. It's your boy Thiz here, and we have Nick, as usual. Welcome back, Nick.
How's it going?
So today we have a very interesting and special episode for you guys today. I know a lot of people who listen to this podcast either haven't even been on dialysis or got told, "Hey, you got ESRD," right? And that's the last thing we want to hear from, a doctor. And a lot of times we kind of get confused on what ESRD is or even what the kidneys are going through when they tell us that. So we, reached out to our community that we have on our Discord, the DIALYSIS. So make sure to check out the link tree so you guys can join and check out the whole community. Right now we have 490 members, so we're very close to 500 members. And we're all very active, and we're all here to help each other. And if you ever need a support system or you feel like you're alone, make sure to check it out. But during that whole outreach process, we found somebody in our community who is actually in the step that a lot of people are in this world, millions of people, that they get told, "Hey, you have ESRD or your kidneys are failing," And we wanted to, make an episode dedicated to people like you where, we're going to answer some questions that somebody like you would want to understand or want to know. And we're also going to let that person, ask us questions as somebody who doesn't know what ESRD or, what the outcome of it is. So we're going to introduce to you guys Alex. So welcome, Alex, to the podcast.
Hello, everyone.
So can you kind of give us a little background about you, Alex, and your whole, the situation that you're in, so the listeners can get some information off of that?
Yeah, absolutely. So initially, I had some pretty unstable blood pressure, and it landed me in the hospital a handful of times. And in doing so, they ran some tests, and it determined that I had a lot of unwanted things in my urine. I had a lot
Gotcha.
of proteins, and they said I needed to see a nephrologist because they wasn't sure what was causing the issues. Um, and it was it was just a lot at once. So trying to think of the word to kind of explain. It turned out I had kidney issues versus the high blood pressure. So
Mm-hmm.
what initially caused me to go into the hospital turned out to be both my kidneys were bad.
Yeah.
Mhm. And uh, it was complete blindside. You know, did not expect it, but uh, there was not really a whole lot of intake
Mm-hmm.
information on it
So
at
they
the
just kind of
time.
told you bad information. They were like, "Okay, well."
Yeah, they just told me that, hey, this is what it is, and this is what you're gonna have to deal with.
Gotcha.
There's nothing we can really do at this time. So and
Right.
that's when they, referred me to a specialist, and I had to go through the process of getting established with them, and then
Gotcha.
ended up needing a biopsy.
Okay.
Yeah.
And then what happened after that biopsy?
So when I had the biopsy, um, it's an outpatient procedure, and they just put you under a local anesthetic.
Mm-hmm.
The surgeon or attendee ended up nicking an artery.
Oh, wow.
And while I was in recovery, everything was fine. I was released after the 4-hour recovery time and ended up going home.
Gotcha.
So ate some food, took a nap. Everything was normal. I was sore. Obviously, you're going to be sore from something like that.
Mm-hmm.
Mhm.
Most definitely.
And I took a nap midday, which obviously it's bound to happen. But as I was getting ready to go to bed, I started having a lot of unusual pain,
Okay.
and uh, I ended up. What ended up happening was my artery ruptured,
Oh wow.
and it. I was bleeding out internally through my
Jeez.
kidney.
Was that just because they messed up during the biopsy, or did they tell you that's like
Yes,
a common thing?
it is not a common thing. They directly told me that there's no statistic for it happening
What?
because if there was, they couldn't do the operation.
Yeah.
Hmm.
So was it like an
So
oopsie or
it was an
malpractice?
oopsie.
Oh no.
Well, it's an oopsie, but there is a potential for malpractice.
Gotcha.
Um, I've still waiting to get all my ducks in a row before I potentially pursue that avenue um, of investigation to figure out exactly what happened and why. But the main thing is to figure out why so it doesn't happen to anybody else.
Yeah.
So I ended up laying down. I actually took, some sleeping medication and some pain medication, which, they recommended a simple Tylenol for the pain because it's just supposed to be soreness. It's not supposed to be excruciating pain.
Mm-hmm.
Mhm.
I ended up having to call emergency services because I was paralyzed with pain.
Jeez.
And come to find out, it's because the blood was irritated because I
Mm-hmm.
was bleeding out.
That's
And
crazy.
when the ambulance arrived, they uh, tried to get me up, and I ended up going unconscious.
Wow.
So I don't know if it's
Jeez.
from the lack of blood or if it was from
The shock.
the
Yeah.
shock or just pure pain. But they ended up I ended up going unconscious, woke up on the floor, got me into the ambulance, gave me some pain medication, which did not work, and ended up going into emergency surgery. So I spent 7 days in ICU,
Mm-hmm.
8 days total.
Gotcha.
So
That's crazy. So
Mhm.
when you got to the hospital, do you remember like them telling you, "Oh, you're going for surgery," or like you said, were you like completely?
I was out of it. I was completely out of it. It was like an out of body experience.
Uh huh. You felt like
Um,
you were in a third person perspective kind of deal.
yeah, yeah,
Wow.
absolutely.
Mm.
And it was like I was watching my body where I could see the sides of my head. It's like almost like I was watching my body through my ears.
Whoa. What?
That's great.
That's
Yeah,
crazy.
it's weird experience, and it's like real groggy, real sick. I ended up getting sick
Mm-hmm.
from the sheer pain. But when I
Jeez.
got there, they pretty much knocked me out right away.
They didn't
Um,
mess with you. They were just like, "Nope, out. You go."
they gave me a second dose of pain medication,
Probably morphine,
uh,
right? They probably gave you some
uh,
strong, strong stuff.
Dilaudid.
Oh wow.
I had 2 doses of Dilaudid, and they knocked me out immediately. There was no. I don't remember them saying you got to have surgery. I just remember being knocked out and waking up in recovery.
Jeez. So when they stuck the IVs, none of that. You just out.
Yeah, I
Yeah.
didn't feel anything. I didn't feel. I think I felt the initial IV in the ambulance,
Uh-huh.
but the second one they put in, I didn't even know it existed.
Jeez. That's crazy to hear that you went through that. So, what we're gonna do now, Alex, is that we're going to ask you questions, from a perspective of somebody that would like to hear the thoughts from somebody like you in your situation who went through what you did and got told, "Hey, you got ESRD." And just to let the whole audience know, Alex hasn't started dialysis. His kidneys are last time you told us it was at what GFR?
I'm at 62% right now.
62%. So he's not on dialysis. He just got told, hey, you got ESRD. Your kidneys could get worse, could not. So this is all from a perspective of somebody who has not started dialysis, but just got told, hey, your kidneys are, not good. So for the first question, well, I guess you kind of already answered. How did you find out that you had ESRD? And you told us that, you went to the doctor and they kind of told you, hey, your kidneys are, 62% or, any lower than that, right?
Yeah, so initially I just got out of the hospital, out of the ICU, and I had a follow-up appointment, I think a week or two later, with my nephrologist.
Mm-hmm.
And that was my first visit, after the biopsy.
Gotcha.
Obviously, in another hospital. And then that's where she informed me that I had my kidneys were in really bad shape. I think at that time I was 52%.
Uh-huh.
Okay.
Um, it went up a little bit, but she said it's something that that will not get better.
Yeah, it only gets worse.
They said it's something I'm never going to recover from. It's just a matter of time
Yeah.
Mhm.
and, delaying the inevitable.
Gotcha. Gotcha. Yeah. Unfortunately, that's something that, when we get told, a lot of stuff goes through our mind. So, can you kind of explain to us what went through your mind when the doctor explained to you what ESRD is?
Yeah. So, my sister was there with me
Mm-hmm.
because I couldn't drive. I was on a lot of different medications.
Gotcha.
And she said that they did get results. And she said I was diagnosed with secondary FSGS.
Mm-hmm.
I don't know how to pronounce it, so it's one of them things.
Gotcha.
Um, and at first I was confused,
Mm-hmm.
because some of my numbers were great, but they wasn't horrible either. So there was no like, oh yeah, your kidneys are bad. There was no expectation of that going into it.
Gotcha.
And then it was just completely being blindsided that, hey, this is what you have, this is what's wrong, this is what's your future's going to consist of.
Mhm.
And it's like I couldn't do anything but stare.
Yeah, completely. Yeah, I understand.
The doctor felt bad because she's the one that pushed for the biopsy,
Mm-hmm.
but it was my brain, my thoughts. I just went numb, and all I can hear was like a loud noise playing through my mind.
Yeah.
Mhm.
It, that's there. You just how can you perform the words to say what you feel in that moment? 'Cause
No,
it's
you
just
can't.
you're
It's
numb.
just no. Yeah,
No.
you can't think of anything. It's just the whole shock that your mind's going through. Because I mean, a lot of people, I feel like whenever they're told they have a chronic illness, it completely, phases them out. It's just like what? It's like it's just so much. Because I feel like for me, when I first got told, it's like how they say that whenever you're dying, like you live all your life in a couple of seconds.
Mhm.
I felt that was it for me when they told me that. Like I just felt like my whole life started playing in my head and thinking about the future and all that shit was just gone. It was just like, okay, well, your whole future plans that you thought you were gonna do, well, guess what? Bye bye to those, right? And it was completely different for me because I had to start emergency dialysis. I wasn't like Alex where they were told like, hey, your kidneys are at 56%, you have FSGS. No, mine was like, hey, you start dialysis now or you're not going to live for a couple of more days, right? So for me,
Yeah.
it was a complete freaking sideswipe for me. I was like, holy. So I can understand where he's coming from for that point of perspective.
Yeah, it's absolutely, especially to go from uncontrollable blood pressure to having ESRD. It's just that's something you do not expect to happen.
No, you don't.
It was 100% unexpected. There was no signs that there was any issues with my kidneys. I had echocardiograms, I had multiple scans, and then never found anything.
It's like that saying, everything is good until it ain't, or something like that, you know?
Yep, exactly what it was.
Damn.
And it's just like, hey, surprise, you have this, and this is your life now.
Yeah. So let me ask you something else. When you got mentioned all this stuff, did anybody ever mention to you about your different treatment options if you got to that point?
Um, yes, so they want to obviously try medication because I'm still in a functioning range, and they want to uh, try every combination possible just to
Mm-hmm.
give me the longest time. But they said that in time, it is inevitable that I will need either dialysis or a transplant.
Mm-hmm.
So there's no stopping it. It's going to happen. It's just a matter of when.
Gotcha.
Can't believe they pulled a Thanos on you right now.
Yeah, literally.
Finger snap.
I am inevitable. Okay,
Yeah.
Yeah. That's all the information they gave me.
that's
Dang.
crazy.
So I guess the next couple of questions we'll have Nick ask you. So go ahead, Nick, take it away.
Yeah. So, like, what do you currently know about dialysis?
I honestly don't know a lot. Um, I mean, I've seen people talk about, the different types,
Mhm.
but myself, I I don't know exactly how it works.
Okay. Now,
Um,
does that kind of like, do you want to not know? You know what I mean? Like, does the anticipation of it bother you if you were to know?
it's it's more of like like I want to know, obviously
Mhm.
for a heads up,
Yeah, definitely.
but I'm also terrified to know
Mm-hmm.
Yeah.
because then it really makes it real.
Yeah.
Like it's
Mhm.
obviously real now,
Mhm.
but it's just like putting a final piece
In the puzzle.
into it. Yeah,
I mean, it's
it's
completely understandable. Some
Yeah.
people don't want to know, they just want to kind of try to feel that last bit of normal sense of life that they have. They're just like, you know what, I'll worry about this later, but I want to worry about myself now mostly. Just take
Yep.
care of myself and take it one step at a time. So that's completely normal. I've heard
Yeah.
that before.
And it's not crazy to sit here and think that. I mean, because I know when I was going through it at 13, they sat me down and made me watch that 80s film on VHS. But it freaked me out beyond belief. And then I never touched hemo at 13. So
Mm,
like they freaked me out beyond belief, and I did PD for 6 months, and I didn't touch hemo till I was in my, you know.
yeah,
So yeah, it completely, they can freak you out very quickly if you're not kind of prepared for it. And I think being in a community like this definitely, if you want to know the question, know the answers to your questions, you can get them here. But at
a
the
thousand
same
percent.
time, if you hang around people long enough, you'll hear stories, and like,
Yep,
it's true, it can be scary, but like, there's enough people who are here who have been through it. Like, they're gonna be real with you, and they're gonna tell you how it's gonna be, but
mm-hmm,
that's not always a bad thing. It's always based on perspective.
yeah,
Like,
it's
we're here to prepare you, not scare you. You know.
exactly. And also, a lot of the times, it's all about, also each person is different. What I go through or what Nick went through dialysis ain't gonna be the same. Neither the way they experience it or the outcome of it. We're
yep,
all gonna have our own scenario, but we're all gonna go through the same type of treatment. And I feel like it also depends on like Nick said, on the person too, how they handle it. You could also be a very good patient and nothing ever bad happens, and you enjoy going to treatments, or you like the environment or whatever, or you could just hate it completely and hate every little aspect of it and make it even worse on yourself, right? So
Yeah,
and not
absolutely.
follow what you're being
exactly.
told
Yeah. Mm-hmm.
and all that sort of stuff. And even if you do, like, there's situations,
Yeah.
here in the community currently where even if you are following everything you're being
Something can
told,
just happen. Yeah.
it just happens, and
Yeah.
you just kind of got to go with the flow. And it
Yep.
sounds
Yeah.
bad to say, but it's the truth.
Yeah,
Yeah.
but nothing's guaranteed in situations like this.
Exactly.
You know,
Exactly.
and when I was first diagnosed after that appointment, I reached out to a friend who actually invited me to this Discord.
Mm-hmm.
Okay, cool.
And that was my first taste of, what's
Really going
going to
on.
happen, what's potential, what I'm actually dealing with.
Mm-hmm.
Yeah.
Because the doctors never gave me any information,
Yeah.
so I was terrified to death.
Yeah.
Like, I'm sitting there thinking, is my life over?
Yeah.
Yeah.
A lot of us think that right when they tell us. I mean, shit, I thought about that too. It's like I got told dialysis. I'm like, die is in the word. Does that mean I'm gonna die? You know?
Yeah, right?
But no, it's we understand, it's a lot.
Yeah, and then helping meeting people that have the same diagnosis as I do really helped out,
Mm-hmm.
and kind of relaxed me
Yep.
because it was pure panic,
Mm-hmm.
and it's like that's one thing I will forever be grateful for is this Discord
Yep.
because I was spiraling quick,
Yeah.
Yeah.
and once you get into the rabbit hole of doing your own research, that just makes it even worse.
Dr. Google at it again.
Yeah, yeah,
I've been there, done that. I know what you mean. And I feel like the number one question Googled probably for dialysis is like, how long do I live on dialysis? I guarantee you that's the number one answer always, or question, Well, how long do I live? Because I know that was the first thing, life expectation on dialysis. How long do I got on dialysis? And like we said many times before, for anybody listening new or, somebody who's listened to our other episodes, dialysis is basically has statistics around people that are older, right? For us young adults, the information is very skewed. It's not, it's not there, Cuz I mean, believe it or not, dialysis is usually somebody that they get it when they're in their late, 60s, 70s, once your body starts shutting down, naturally,
Yep.
But for us young adults, I mean, I started dialysis when I was 28, Nick started it when he was goddamn what, 13, or no,
And
from birth
then again
probably.
at 21.
Yeah.
Well, yeah, it's a birth defect is what I think.
Yeah.
Yeah.
And Alex,
Mechanically.
how old are you right now, Alex?
I'm 34.
Yeah. So we're all young adults, and the information isn't there. They're not gonna put on Google, hey, you're 34, you're 28, you're 13, you're gonna live 5-10 years. No, it's not like that. We're younger. Our bodies, can support more than somebody in their 60s or 70s, right? So the information isn't correct on the internet. So if you guys ever go and Google how long am I going to live on dialysis, it's probably going to tell you 10 to 15 years because they're thinking you're 60 years old or 70. And even at that age, that's good. That's another 10, 15 years, right? If you're 60, you're going to live up to like 75. If you're 70, you can live up to 80. Who knows? That's a good time. But 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 yeah, it's not, for us, the whole end game is, go to treatment, take care of yourself, be compliant, go to your treatments, get a transplant, continue living your life, right? So
Yeah, absolutely.
Now, with all that being said, did they give you kind of like an idea or an estimate of how long it might be before you did end up starting dialysis?
Well, initially they said it's based off my medication and which one works.
Okay.
If they could stop the protein or as much protein getting into my urine, then it could be, 10 to 20 years.
mm-hmm.
That's pretty decent.
That's
Um,
pretty good. Yeah, shit.
Yeah.
yeah. So, that's with the blind hope that the medication works.
Yeah.
Okay.
Um, at the beginning, I wasn't as hopeful because my numbers are all over the place and my body reacts weirdly to stuff like that.
Mm-hmm.
hmm
So I've never really been one to really trust medication. You know, it's, so it's I hope so,
Mhm.
but I don't think it's going to be that long.
What if I may ask, what's the medication? What is it specifically being targeted for?
So the medication I'm on, it is um, to so you have millions of pores in your kidneys
Yes.
that filter and then send stuff through your urine that filters out of your body. So with my diagnosis, the lower half of my kidneys, it's scar tissue. So all that shrunk up
Okay.
and it's opened up the upper half, the ports. So all those millions of ports are a lot bigger than they should be. And they're letting too much go through. So the protein is not supposed to go through any of your urine. The pores are supposed to be small enough to block that from happening.
hmm
Mine are open and it's letting all that go through. So which in turn is damaging my kidneys even more. So the medication is the hope to reduce those pore sizes,
And so this is both kidneys?
both.
Okay. Okay. Okay.
So the right one is a little worse off because they, when they went in
Then,
to repair the bleed,
mhm.
they had to cut blood supply off to the upper section of my kidney.
Oh crap. Okay. Yeah.
And this isn't the pores being bigger on the kidneys that you have. It's not. Is it a side effect from FSGS? Do you know of, or is it just from the whole trauma that your body went through?
It is a side effect of the FSGS.
Gotcha. Okay.
It's a direct cause and effect. At least that's what was explained to me. So um, they're hoping the medication can, help it a little bit.
Mm-hmm.
Because if not, then obviously, then my time is not decades. It could be a matter of months or within a couple of years.
Gotcha. Okay.
Well, so I'm gonna finish up with my last question here is what's been your biggest worry since getting the diagnosis?
Collapsing. Honestly, it's relying on the medication, knowing that its potential it doesn't work, and waking up one day and my kidneys are shutting down.
Mm-hmm. Yeah, that
Yeah.
would. Yeah.
Like that's my biggest worry, and it's a pretty valid thing to worry about,
No, yeah, 100%.
Mm-hmm.
especially considering kidney issues or there's no playbook to them.
No.
Mm-hmm.
No, it's just dialysis.
Yep.
No, there. It's a lot. So, have since you've been I mean, I know you mentioned earlier, you mentioned family, like, and stuff like that, but have you talked with your family or friends about, what's coming next, or how have they reacted to all that information?
Yeah, I've kind of let everybody know that it's um, it's obviously not good and that there's no cure for it.
Mm-hmm.
And the initial reactions are just like shock, like they can't believe it.
Gotcha.
They can't understand why or how it happened or why I have to go through it and
Mm-hmm.
why there's no direct fix for it.
Mm-hmm.
And unfortunately, it is hereditary, so I have to. It runs in my blood.
Yeah.
So there's previous family members, grandparents, greats that have succumbed, had kidney issues when they passed.
Gotcha.
So
Okay.
it's always there in the back of the mind, but as you pray, it's not something you have to go through. My friends have been supportive, but they don't understand,
Mm-hmm.
and most people I don't think will unless they actively experience it.
Yeah. That's
Yeah.
exactly. And that's the thing while going through dialysis, a lot of people are like, "Oh, I understand what you're going through." I feel I'm like, "No, you don't."
Nope,
Is like
not a clue.
you don't know what it is to be next to a machine and only be alive because of that machine. It's like until you are next to that damn machine yourself, then you can tell me I understand you. I know what you're going through. Because I feel like
Mhm.
that was the one thing that pissed me off the most about like going to dialysis or like telling people that I'm on dialysis. I'm like, oh, I'm sorry. It's like I understand what you're going through. It's like no. It's like don't say that. That's like the quickest way to piss me off. It's like do not say what I understand what you're going through. It's like you haven't been through it. You know, you're perfectly healthy as far as I know. You know, unless you tell me you're on dialysis or I see that big ass fistula on yourself. You know, it's like you don't know, right?
And the thing is like if you had been through something like the top 10, like diseases in the world, like
Mm-hmm.
chemo, or like been on ECMO with like lung, transplant stuff, or had to get like liver or pancreas, something along those lines. You know what? That's respectable because if you sit here and say it, to an extent, we're on the same page.
Yep, exactly. Yeah, you know
And
the
so, like,
struggle.
you understand where we're coming from. You understand the struggle. Not on the same levels, obviously, because even on like cancer and like ECMO and all these other sorts of heart transplants, all these other sorts of things. There's different levels to those too, and I'm not speaking for those individuals. I haven't been through those things.
Mm-hmm.
But just like it is here on like kidney transplants and dialysis and end stage renal, we all go through it at a very different rate. Some people are fine today, on in dialysis tomorrow. Some people are on dialysis for 30 years and then get a transplant. Like everybody's on it at their own, and it's complete their own story.
Exactly.
Um, and so when somebody who's been through those sorts of things say, like I understand, you know what? To an extent, I feel them because like out of anybody who's been through anything, they would come the closest to understanding.
Yeah,
Yeah.
absolutely. And then, like you said, it's like people saying they know, but they really don't. But you have to go through something like this in a similar capacity to understand.
Yeah.
You have to, it starts with that initial diagnosis, like that feeling of finding out that you're in trouble. You know, that's something you can't understand
Yeah.
until you've been through it. Like you said, Nick,
Mm-hmm.
this, compared to this, compared to this, like anybody that's been through this understands to an extent.
Mm-hmm.
But for the outsiders looking in, they don't have a clue,
Yeah, true, true.
and it's like you get the friends that say, I wish I could help. And then the hardest part is telling them that you can't.
Well, if my question to you is, if your friend or somebody asked you, okay, and I understand, like they can't physically help you, not at this moment in time. But what could a friend do if they ask, if they sit here and said, I wish I could help you, you know, what would you sit here and say to your friends now, or family, or to an individual out there listening to this podcast? What could their friend or family member do at this moment in time to help them?
Just be there. Be there for them. Listen. Talk through things through. If they need space, give them space. Because you don't know directly what they're going through. So be there emotionally. Understand there's times where they're not going to be able to tell you how they feel and you understand it.
Yeah,
So just
and
be a friend, be family, accept that this is a reality. You know,
mhm,
do what you can as a friend to help, and that's going to be emotionally.
mhm.
Show up. Don't let these people that have had their life, drastically altered go through this alone.
So just like we've talked in some of the past podcasts, in regards to stuff like this, is just sometimes it's just a good friend is somebody who will sit there in the trench with you. Sometimes,
Yeah,
like
absolutely.
that's all it takes. You ain't got to do anything. You ain't got to help me dig my way out. we'll do it together in a minute, you know. But like at this current moment, it's just somebody who will sit down in that trench with you and just be there for you.
Yeah, absolutely. Because nobody in my direct life has gone through this. You know, nobody in my circle of friends, family has dealt with this or anything comparable.
Yeah.
So just being there, you know, to pick up the little pieces, because when I was first diagnosed, I was alone.
Yep.
You know, I had nobody to help me, you know, emotionally or mentally until I got into this Discord. Like that directly changed my aspect of my life.
Yeah. Okay. Are you more curious or more nervous about the process ahead?
No, I'm absolutely terrified.
Is
Because
there anything specifically that you've heard about, people like talk about in the Discord, or you've seen or heard elsewhere that kind of like really produces a lot of like nervousness and anxiety?
the pain and the sickness,
Mhm.
you know, just the exhaustion, you
Mhm.
know, and all of that combined just absolutely terrifies me. You know, they say you feel better, you know, for a little bit, you know, but it's just it scares me, you know, to have to think about that I'm at some point in my life I'm gonna have to go through this same thing.
Mhm.
You know, and knowing like when you're outside looking in, it sounds a lot worse than it is.
Yeah, sure.
You know, a lot of people have told me that, you know, it gets better.
Mhm.
Like especially, you know, post transplant, you know, you feel better. So it's just the initial of scared to go through the phase of hurting and having to do all this that, you know, it just makes me a nervous wreck sometimes.
Understandably. Understandably. Have you started thinking about lifestyle changes you might need to make?
I've actually started lifestyle changes.
Okay.
I went to I cut out a lot of sugar.
Okay.
I cut out a lot of pop, soda,
Okay.
you know, whichever people call it. I quit that right after my diagnosis. And I've had three in the last like 6 months.
That's pretty good.
So it was cold turkey. Um, you know, I've always been overweight. It runs in my family. You
Mhm.
know, obesity and all the nonsense. You know, it runs in the family. So, you know, I was told that I needed to drop weight, which obviously I have um, since the initial um, diagnosis and problems arose. I'm down 40 pounds.
Mhm.
You know, so it's like the weight loss and then cutting out the sugary drinks and the sweets. So now it's just water and zero sugar, you know, Minute Maid drinks and you know, alternatives, you know, the Mio drinks, the water flavorings.
Mhm.
Um, but I know my diet is going to have to change. You know, that's going to be my next big drastic change because I'm going to have to cut out a lot of the things that I love.
Yeah. Okay. And then if I can ask the last one here, it'll be if you could ask someone who's already been through this anything right now, what would it be?
What was the first dialysis treatment like? You know, and what surprised them the most?
Okay. Are you curious about what mine was?
Yes, absolutely.
Okay. Um, so back at 13, um, I didn't start right away and whatnot. So like it was like a 2 month kind of thing. It was like a slow burn into dialysis, at the get go there. And so nothing was very rush. I finished with 8th grade and stuff like that, and I got a PD cath placed, and everything was very laid back, very very different than the me going back into dialysis at 21. 21, it was I feel kind of ill. Let's go to the ER kind of situation. I got a hemo, like a CVC cath placed that night and started hemodialysis in the hospital like the whole week, and then got relieved and started doing hemo in clinic. That first hemo session was completely different from in clinic. And I guess why it was so different was because I had never been in a hemo clinic up until 21. Okay. And a lot of things just happened very quickly. And when I was in the hospital, like it was a 2-to-1 ratio. So it was a 1 nurse to every 2 patient ratio. Okay. And it was a nurse, mind you. Okay. When you get to a clinic, it's like a 5-to-1 ratio, so 5 patients to 1 technician, not nurse. There's 1 nurse for the whole floor, and you have a technician who only has like 500 hours worth of training, which I'm gonna be honest, at this point in my life, I have more training than them by years. Okay. Um, so that's a thought process there too, And they in the hospital you had like curtain, like block of the like your sight line from the patient next to you and your machine from the patient next to you and that sort of stuff. It's a little bit more relaxed environment, because of that. You're a little bit more tended to. In a clinic setting, you're almost, to an extent, mind you, it's a lot more your care is up to you. If something is going on, you need to speak up, because we can't keep an eye on all patients, kind of scenario.
Yeah, so
And
you kind of got to fend for yourself.
truly, and your neighbors in a clinic are your best friend. When I say that, like you ain't gotta love them, but if you start freaking out, your neighbor needs to like speak up on your behalf and draw some attention. So like y'all may not love each other and be lovey-dovey with y'all need to be friends, respect level. And you need to watch and look out for each other's backs. And that's not just like if something's going down on my machine, or call the tech or nurse. That's if a tech ain't doing something right and you see it, speak up to me about it too. But in clinic settings, they don't have curtains between machines, which, coming from a very like clean PD environment, that's, I'm not gonna say sanitary, but my own germs in my own house,
Mhm.
it looks scary because like there is like maybe a foot between machines, maybe a foot between patients. And so there's not a lot of space. Like you're all crammed and like it looks like sardines into a can, in a clinic. And it just feels like it's very, and it is, let's be honest. It's commercial. Like they're there to make money. You're the money, you know. And they're just trying to get you in and out as quickly as possible. And so
Yeah.
it's a numbers game. It's not quality, it's quantity, for them. And so you'll get in there, and I'll never forget that first day you go in. You have to sign a lot of paperwork, like HIPAA forms and this and that and other, yada yada yada. And then at the end of that, they'll sit here and ask you, hey, like we want you to get the flu vaccine, we want you to get Hep A, we want you to get like Hep B vaccine, and there's like 3 or 4 of them generally. Okay, and the curious person I am, okay, I was gonna go, why? Like, explain to me why you recommend this, and then as the patient, I will make these decisions myself. Because I'm gonna be honest with you, flu vaccines by themselves I get extremely sick as a dog for like 2 or 3 weeks. Like it's as if I got the flu itself for 2 or 3 weeks.
Okay.
And so that accompanied with already being on dialysis, feeling like crap, doesn't make anything better for me.
Yeah.
So I sit here and I was like, "What are you all these for?" I was like, I straight up told him I was like, "I'm gonna pass on the flu vaccine." So explain to me these other 2 options. We'll go from there. And they were like, "Well, like Hep B, like you can get Hep B from blood from somebody else being flicked on you, or like blood from their lines like getting into your blood." And I was like, first off, if y'all flick blood on me, y'all gonna need more than Hep B, okay? Because I'm gonna throw hands.
Yeah. Right.
Okay? So I don't know why y'all be flicking blood on people up in the clinic, okay? So and they sit here and say, well, no, it's not a matter of like us actually trying to flick blood on somebody. It's a matter of if it was to happen. I'm like, why would that be a problem? And so like I hadn't seen the inside of the clinic yet. And when I walked into the clinic and I did not see curtains between each chair and machine, then it made sense. And I started freaking out. I like legit broke the fuck down. Okay. Like I started like tearing up, watering, like my anxiety shot through the roof almost instantly. And they like brought me back off the floor and like put me in the back room with my dad, and the social worker had like, she was like, "I'll be right back," and like left the room and gave me and my father a moment together. And I was just like broke down for like a solid like 5 and he was like, "What?" And him was like, "There's no curtains, like they're like side by side. Like I understand now why you could sit here and get Hep B, because there's nothing there to protect you, like there's no sort of like see-through curtain or panel or anything like protecting one machine or patient from the other." um Inevitably, mind you, I decided on my own behalf that I was not going to get any vaccine. And they were like, "Well, if you get Hep A or Hep B, like you could die." And I'm like, technically speaking, I could die here anyway. Let's be honest.
Yeah. Right.
Like I'm taking a gamble. Like realistically speaking, I've heard the numbers are, while being on end-stage renal disease, like having dialysis every day, you're on dialysis, it increases your chances of death by 50%.
Yeah.
Like statistically speaking, so like you're 50% more likely to die than a normal human being. And I mean, let's be honest, it's strictly because of what dialysis does to the body. Like it's a coin toss every day, like you're flipping. And like, yeah, the odds aren't great, but like the odds aren't bad either. Like 50-50 is still pretty decent,
Yeah.
It's better than 100%,
Yeah. Right.
So you have to kind of like pick your battles on that one. And you just got to remember, like, you're in control. It's scary, but you're still in control to an extent. And that's such a hard thing to get across to a lot of new patients, because a lot of new patients are so hell bent that, oh, my doctor's the best doctors, my nurses are the best nurses, my techs are the best techs, and they're doing everything on my behalf that's in my best interest. And I'm like, you know what? In a perfect world, that's wonderful. That's absolutely wonderful. And I hope the best for you.
Yeah.
But if you're not questioning things every step of the way, you should know. I'm not going to say you should know as much as your doctor, but you should question your doctor on everything. Like, because what you decide is in your best interest needs to be based off what they give you options. If they're only giving you one option, they're giving you no options.
Yeah. That makes sense.
And that's so hard for new patients to understand, because there's so many of these doctors, not so much nurses. Techs just don't understand, the what this even looks like generally, from
Yeah.
patient side. But they're a lot more empathetic, generally speaking. But doctors, they'll walk in, and I don't know if it's an ego that they get because they have a white coat on, but they'll just sit here and they'll like look at you and be like, "We're doing this." I'm like, "Whoa, hold up. maybe step back out of the room, come back in, let's restart this again. Hi, good morning, how are you? And then, like, yes, doctor, what are my options? And you give me A, B, C, a couple different options here, and then I go, oh, I really like this option. Can we weigh pros and cons? Okay. You know, sure, it takes the doctor a little bit more time, to sit here and like talk this over with you, but that's what they're there for.
Yeah.
You know? So, Fizz, you want to sit here and give your 2 cents on what that first time experience walking into a dialysis center was like for you?
Hey guys, what's up? Hopefully you enjoyed the episode so far. We have to split this up into 2 parts. This was just part 1. We're going to release part 2 next week, so stay tuned. And until then, take care of yourselves, love yourselves, be your own self-advocate. See you later. Peace.